First thing we need to give our patient is a powerful explanation. As Tony Lee et al. Said in Angle Orthodontics in 2008, patients tend to overestimate the pain anticipated with mini-implant surgery, but after the process, most of them would recommend it to others. For example, patients' experiences of pain decreases significantly over the 7 days and recall 1 month after replacement of meniscus. Over half of the subjects reported that they only experience a little pain or no pain and had no swelling around the cervical site. Second, we need to be clear explaining them we are not going to do a flap surgery, so it avoids them any type of suture. Most patients associate suture with uncomfortable treatments, so it has to help us to support their motivation. Third, if our case would need premolar extractions, you should know that Niels Gansa in Angle Orthodontics in 2016 published that the ability to drink and the ability to take a big bite were significantly less disturbed just in the evening after screw placement compared with extractions. Cornelis et al. Said in her article from 2009 that restricted mouth opening concerned 17% of patients initially, but became or remained minimal after 6 months and 1 year. But in the other hand, cleaning the anchors was a problem for 15% of the patients, and it's continued over the time. Another example would be our traditional transpalatal bar cases. Ingeli-Feldman in European Journal of Orthodontics in 2012 compared 3 anchoring groups, and they showed patients from baseline to the retention phase peaked on day 2, almost back to baseline on day 7. Skeletal anchoring groups have significantly less pain intensity compared to the transpalatal bar group the first 4 days of treatment, and the first result visit after 6 weeks. First, we will conclude our explanation saying there is no difference found between sex or age. However, Spiridion Papageorgiou published in 2012 higher overall meniscus failures in the mandible, near to 19%, over the maxilla, near to 12%. In addition, meniscus implants placed between the mandibular second premolars and first molars have significantly higher failure rates compared with meniscus implants placed between the first and second premolar. So, having this information clear, we move forward our Yale Medical Cut.